So now we're talking about the middle-sized gluteal muscle, gluteus medius, a big deal cause of trigger points. Very common. This is a posture muscle. So the gluteus medius, if we lie like that, the iliac crest is here. Here's his iliac crest, and the second major structure is the greater trochanter of the hip, which you can feel as a large bump. The greater trochanter is just here, and I'm going to draw it as a round bump. So the gluteus medius starts from behind the maximus. So maximus actually covers part of the medius. It attaches to the inside of the crest across to there. Here to here. It's a fan-shaped muscle, and it runs down like this to attach into the greater trochanter of the femur. It's quite a broad attachment. In fact, there are fibers that run this way, and then there's another part of the medius which comes even back further, and that runs quite horizontal. So the functions of this fascinating muscle, there are actually two fundamental ways that the muscle works. The first is that if you're standing on your left leg, so in other words the opposite leg, then if this muscle contracts, you will lift your leg up. So that's an abduction of the hip. The second is that if you stand on this side and you lift the opposite leg, this will contract and act as a check rein to stop your pelvis dipping. And that's actually the primary function of this muscle. So it is a stabilizer of your pelvis, and therefore it's a stabilizer of your whole spine. Your whole axial spine is stabilized by this muscle, making it incredibly important. So whenever you lift, whenever you're standing on one leg, as in walking or any time that you lift that leg up, this muscle is the primary stabilizer of the whole axial skeleton. And that makes it a vulnerable, very vulnerable muscle. It's got quite a lot of type 1 fibers, which are the grunty fibers, and it is a muscle that often gets trigger points. And there are 3 trigger points in this muscle, and they're all sit just under the iliac crest. There's one here, there's one there, and there's one right in the front. And when these triggers are active, when this trigger is active, you feel the pain here. So it's in the classic lower back pain area. That's this trigger. This trigger gives you pain more lateral, and this trigger, again for some strange reason, gives you this classic muscular lower back pain. So these triggers, you need to think of these triggers because they're very common. They're very commonly missed because somebody says, my back's hurting, everyone prods around here. You may find stuff in this area, do manipulations, do stuff, but what people miss are these very, very important triggers. The way you find them, the fibers run in this direction. These directions, they fan out, so you feel under the edge of the iliac crest, you duck your finger in, you search for you move backwards and forwards until you find a tight band. Once you find your tight band, you focus in and you find a thickening, and then you press firmly enough on that thickening. You find out whether there is pain, If he says that's sore, then you reduce the pressure to just below the pain threshold, and then over the next 20 to 30 seconds, you sit and then you slowly increase the pressure, increasing, staying below the pain threshold until the trigger itself melts away. So that's ischemic pressure to treat these triggers. The second is using a ice pack, and you start from the origin, you run to the insertion. Now this is tricky because the pain zone is over here. So what I tend to do is I tend to start here and I run into the pain zone and then I run down to the insertion. You could also run down there and come up here. Two options like that. But I tend to do this, run down into there, do 2 or 3 runs, and then, because this muscle is shaped like a fan, the fibers are coming from different angles. The fibers from the back will abduct the leg, but they'll also extend the hip because they're pulling from behind. So if you wish to stretch this muscle, what you do is, can I take your leg, bend it, and you drop right over there, drop it down. So you drop the leg down over the other side of the bed, holding his pelvis, and you can see as your leg drops down, so you will get the back fibers stretching. If you want to stretch the front fibers, can I take your leg again? Then what you do is you extend the hip and drop it down the end of the bed there, and in so doing you will stretch the front fibers. And to treat the muscle, you stretch them all, but the most important thing is to pick where the trigger actually was, and that's the area that you're really going to focus on. Now, as you do your stretch, you use Neuromuscular Technique, and so you would take a breath in to the count of 6, breathe out, keep counting, 7, 8, 9. By about 9 or 10, the whole leg will just start to drop, and the muscle will continue to stretch out to length. Then you apply a hot pack to the muscle and repeat the stretch.